Ms Payne.
Thank you, Acting President. I'm going to rise today just to make a brief contribution on this bill that introduces reforms to provide a police reservist scheme in Victoria. Now, the proposed scheme will boost capacity and ease pressures on frontline police officers by enabling police reservists to perform a number of administrative and supportive tasks. Now, we know that this is a temporary measure to plug the gap, essentially encouraging retired police officers, former serving police officers to come back on board into the police force to provide some administrative duties and take that pressure off frontline workers. We know that there are currently 1,500 to 2,000 unfilled positions within Victoria Police. So this very much is a temporary measure. The situation is not unique to Victoria. Staff retention and recruitment is a huge issue in every state in Australia. Police are leaving the police force in droves. Now that's due to toxic workplace culture, to burnout, to the ageing police force. But this gives us an opportunity to rethink where police resources are best utilised, and that's some of the contributions that I want to contribute to today. We know that police are currently being called out to deal with mental health issues, family violence issues, and to deal with poor behaviour in and out of home care. We think that it could be better utilised looking at alternative first responder models, mental health workers attending sites, specialised family violence support services attending. Currently, when it comes to family violence, and Mrs Herman's raised in Casey City Council, we have a huge issue of family violence in Casey predominantly. And police are being called out to family violence incidents as the first responders, obviously. Any sort of violent incident, it should be police as first responders. But often they don't have the specialised family violence training that is needed. Now, I've spoken many times in this chamber before about the Alexis model. And what we are seeing with the Alexis model is where you have a specialised family violence unit supporting both perpetrators and victims of family violence. We have seen very positive outcomes in that space. This model is currently only in a trial phase, and it is active in 5 family violence units within the police force. Now, I have advocated time and time again for that model to be implemented in the South East, as I indicated before, and as many in this chamber have spoken about. Family violence in the South East, and predominantly in the Casey Council area, is highly prevalent, and it is quite a unique space to be looking at, particularly as there is such a culturally diverse community in Casey. There is new developments in Casey. It's a fairly new community. When we do look at the Alexis model and how successful it is, in its trial phase only, we are seeing an 85% reduction in family violence recidivism. 85% reduction in family violence recidivism. Now, think about the police time and resources that could save through ongoing, recurring call-outs of police when you have a specialised family violence unit allowing people to access services quickly and effectively. We are seeing a reduction in misidentification. We are seeing survivors being able to access the support services that they need. And we are also seeing perpetrators access services they need to change their behaviour. Because let's face it, not everyone wants to leave a family violence situation. They want the behaviour to change, and that's what these units are doing. They are specialised units and they are effective. Interestingly, 75% of victim survivors felt that the program helped decrease family violence in their lives. Now, this is an example of a way better model of operating where you have specialised family violence unit working with the police and effectively taking away a lot of the burden on police to be those responders to family violence time and time again. This is about changing behaviours. Another issue I wanted to raise in particular around rethinking police resources and how we could better utilise police resources is obviously I want to talk about drug law reform. Now today the Pennington report issued their Australia's annual overdose reports for 2026, and what it showed, alarmingly, is that 7 Australians are dying of overdose every day. Now these are preventable deaths. One person is dying every 3.5 hours of overdose, and that data is from 2024. Now, how is this related to police resources? Well, when you have police attending or stigma associated with criminalisation of drug use, you are less likely to see people who need access to health and service provisions accessing those provisions. I heard on the radio this morning Alison Ritter from the University of New South Wales, who is an illicit drug policy researcher and expert. And what she says is that a much bigger share of government funding is spent on law enforcement than on harm reduction. And I'll go on to quote her. She says, "We've got good evidence from research that we've done that it would be far better to refer people into harm reduction and treatment services than to put them through the criminal justice system." And she goes on, "Only half the number of people who are seeking treatment are able to receive it. And there's no other health-related condition where society says we're only going to treat half the number of people who may require it. This is a huge gap in the system." Now imagine if we decriminalised all drugs and treated drug use as a health issue, not a criminal issue. And this was some of the experiences that we got to delve into as part of the Legal and Social Issues Committee. We went to the ACT and spoke to Scott Lee, who is the ACT Police Commissioner, and a number of public health experts around decriminalisation of cannabis, but also decriminalisation of drugs more broadly. And what the Police Commissioner identified was that the administrative burden that has been lifted because there is no longer the criminalisation of all drugs in the ACT has had a huge impact on their ability to put frontline services, put frontline police officers where they are most needed, not dealing with victimless crimes around drug offences. Now, when we reduce stigma, we know that those that need access to help and services do, in fact, access it. By removing stigma, by removing that criminalisation, you allow people to effectively move forward with accessing help where they need it. And obviously with cannabis reform, we still see roughly 4,000 Victorians arrested every year for cannabis possession. Now we're talking about small possession charges, under 50 grams. It's a young person having a joint on them and getting busted at the train station. It's someone at a rally having a little bit of weed in their pocket and getting picked up by the police. We know 4,000 arrests a year has to be a huge weight on the police resourcing that we currently have, especially when we are down 2,000 officers. 80% of the community believe that cannabis should not be a criminal offence. 80%. I'm not the only one saying this in this place. And when it comes to the cost of police time and resources, the PBO, the Parliamentary Budget Office, recently did some costings where they indicated the operating cost of policing cannabis-related crimes in Victoria is estimated to be approximately $5.8 million per year. Now that accounts for around 56,800 hours of police time. If we equate that to a full-time workforce, that's 27 full-time police officers. And that's just on cannabis reform. Now that would be an extremely low result as to an estimate, I would think. So in summary, I think that we can identify the huge amount of money is currently spent on policing, and I'm not too sure that it actually makes our community much safer. I think we have a real opportunity in this place to talk more about where police resources are fundamentally needed, and we know that that's in relation to any violence within the community. Police should be there, first responders, right there and protecting our community. There's no denying people should feel safe in their community. But it is time that we rethink some of these outdated laws that currently impede police from actually being those frontline support workers that they are, where they're needed in comparison to drug-related offences. Thank you.